Hi, good afternoon, everybody, and a big thank you for joining us in our first ever virtual annual awards recognition event. My name is Kelsey Hale. I'm currently serving the last few weeks of my board chair position on the New Futures Board of Directors. I'd like to start by just expressing my sincere congratulations to all of tonight's honorees and extend a big thank you to the New Futures staff for their innovative thinking and devotion exhibited over the past few months to make sure that we're still able to recognize all of you and show our appreciation for all of our advocates and our partners. It's certainly been a very trying time. If there's one word I would use to describe the past year, it would be adaptable. Despite the challenges that the COVID pandemic has brought from a logistical perspective on our policy advocacy work, I'm so proud of the way that the staff of New Futures and our partners just embrace this challenge by rolling up their sleeves and just working even harder to find creative solutions. With New Hampshire legislature being suspended for several months, New Futures took the opportunity to shift focus during that time from our campaign priorities to providing a wide range of COVID-related resources. However, when remote hearings, committee meetings, and votes started to happen rapidly, the focus was quickly shifted back to our campaign priorities. Without being so adaptable to the ever-changing environment, the accomplishments of the past year would not have been possible. Together, we continue to find ways to encourage legislators to support policies that allow Granite Staters to start healthy and stay healthy. We led the prescription drug access and affordability charge, and House Bill 1280 was signed into law in July. We made sure to have a seat at the COVID-19 coalition table to address workforce, funding, and telehealth issues, and House Bill 1623 was signed into law in July. And we're still seeking Federal CARES Act funding to be directed towards recovery housing providers and individuals. Preparing for 2021 has and continues to be tricky. However, there are a few measures that have taken place to position us appropriately for the next session. We have created and distributed a survey on community needs to help inform 2021 policy priority selection. We've outlined a plan for listening sessions held in each community to help inform 2021 policy priority selection, and have begun to host listening sessions for early discussions. We've revised and released a new training menu based on feedback and experience of our existing program. We began advocacy trainings open to the public conducted virtually, and we've started to take a deeper look at our own organization's role in breaking down inequity and addressing the disparate health outcomes for people in communities of color. Again, I'd like to thank everyone for their commitment to continuing the fight for our very important work. We could not do it without you. Before we turn things over to Michelle and the New Futures team to introduce tonight's honorees, I would like to first introduce you to the incoming chair of New Futures Board of Directors, Gary Livoy. I know whatever curveballs the next few years bring to our work, rest assured, we will be in good hands with Gary's leadership. With that said, I'll turn it over to you, Gary, for a few comments.
Thank you, Kelsey, and thank you to all who are tuning into tonight's event. As Kelsey mentioned, my name is Gary Livoy, and I'm pleased to be New Futures' incoming board chair. When I first became involved with New Futures as an advocate, I learned about the impact of citizen voice. I have to say that I'm proud that despite the circumstances of this moment, New Futures continues to provide incredible opportunities for individuals to engage and support policies which better our state. Whether that be through attending a webinar or educational virtual film screening, drafting a letter to the editor, hosting a phone bank, or testifying on a Zoom hearing before the legislature. The opportunities for civic engagement are still there. And as Kelsey has pointed out, the New Future staff are also there, ready and willing to help you along the way. Throughout tonight's program, we will be celebrating the past as much as the future, lifting up those who are role models in advocacy and sending out messages of hope. Civic engagement remains as important now as ever. During the last year, New Future staff have supported partners and led coalitions to address issues with healthcare access, prescription drug pricing, and youth prevention, all of which were successfully advanced. And I need to make this as clear and plain as possible. This work would not have been possible without you, our advocates and partners, and the hard work of New Future's incredible staff. So thank you. Now, before turning this over to Michelle for the next leg of the program, there's one other individual I would like to take a moment to recognize. Mark McHugh, the Secretary of New Futures Board and our Governance Committee Chair. During Mark's time with New Futures, he helped to guide us through significant organizational change. Mark also modeled advocacy for others, fighting to remove barriers to behavioral health treatment services for those in need. Mark will be reaching his term limit on the Board of Directors in November. I would like to take a moment to show our gratitude for his many years of dedication and service. On behalf of the entire board and the staff of New Futures, thank you, Mark. You will be missed. And now I'm happy to turn this over to Michelle Merritt, President and CEO of New Futures. And I hope you enjoy the rest of this virtual event. Thank you.
Thank you, Gary, and thank you to all of you who have joined us for our 23rd annual recognition event. As is plain to everyone, the format for this year's event is different, as are many events, and I have learned a little bit over the past few months about what it means to hold a successful Zoom meeting and a Facebook Live event, and it means keeping it short. So thank you in advance for spending the next hour or so with us as we recognize and appreciate the incredible work of this year's award winners. To keep things interesting and interactive throughout today's program, you're going to see some notes pop up with keywords throughout our program. Please pay attention, and if you see a keyword, post the word in the Facebook comments of this stream, and you'll be entered into a drawing for one of 3 really amazing prizes: a pair of AirPod headphones, an Echo Dot, or admission to the 2020 Behavioral Health Conference. For those of you who have attended this event in the past, you know that tonight is intended to be a night of fun and celebration. And while we can't be together, we can certainly still reflect on the past year, try to reconnect, and celebrate those who embody New Futures' mission, who are working every day to improve the health and wellness of all Granite Staters. We at New Futures have a deep understanding that working towards policy change is truly a team effort. And there is no doubt that we have made some great strides over the past few years with our partners. And we're pleased to be able to highlight just a few of these wins tonight. However, I can't sugarcoat this. The year ahead is going to be challenging. The investments we have all fought for over the past few years will be threatened by budget shortfalls and competing demands for state resources. We all also share a responsibility to ensure those who have been historically marginalized and excluded from the policymaking process are listened to, truly heard, and are supported in the months and years to come. For me, as it has been for many, 2020 has been eye-opening and prompted needed evaluation of New Futures' role in advancing health equity and breaking down racial bias. While this work starts inward with internal policies and procedures, New Futures is committed to using our position to help advance underfunded partner organizations aimed at elevating the voices of individuals and communities of color. This past year, we funded 8 new partners in health equity work through field grants, and we hope to continue to provide this support to them into the future. The new legislative session is going to bring with it new opportunities for civic engagement and policy change. And given the known fights ahead of us, there is a clear role for every advocate, every partner, and every policymaker in protecting New Hampshire's most vulnerable citizens. 2020 is also going to require vigilance. It depends on our continued progress against the addiction and mental health crises, whether or not we're able to sustain the future of early childhood fundings and programs, and to support our public health infrastructure, as well as the full implementation of a system of care for children's behavioral health. These all depend on our vigilance. So please, be engaged, fight with us, and when you see a call to action, act. If you need support to take action, remember, as Kelsey and Gary both said, we are here for you. Take a training, ask for support in writing an op-ed, reach out for some technical assistance or support, and apply for one of our advocacy field grants. We are all stronger and more successful when we advocate together, supporting a shared or common interest and encouraging the individuals that we serve to share their own stories and lived experience. Like many nonprofits, New Futures relies on support from generous grant funders, sponsors, and individual donors, which maintain and expand our core programs, as well as our shared service trainings for nonprofit partners. I want to take a moment to acknowledge and recognize our funding partners, the New Hampshire Charitable Foundation, the New Hampshire Endowment for Health, the New Hampshire Children's Health Foundation, and Annie E. Casey. Your support and understanding that policy change can move the needle for the better in this state is an endless motivator for all of our advocacy efforts. Thank you for your partnership. We deeply, deeply appreciate it. I also want to pause and take a moment to recognize and thank New Futures Board of Directors. In this moment, your governance of New Futures has been as important as it has ever been. Your vision for the organization is deeply appreciated by the entire New Futures staff. Thank you so, so much for your time, your expertise, and your dedication to us. And last but not least, to the New Futures staff. As an executive director of this organization, I could not be prouder of this team. Working with you every day is an absolute privilege. Your passion, adaptability in light of COVID, and focus on our mission has led to some incredible innovation in the past year. I appreciate each and every one of you every day for showing up for the Granite State and for those who are underrepresented in our work. You have made and continue to make a difference. I hope you know that. Thank you for all that you do. And now is the time where we're shifting gears and we're going to recognize our 2020 award winners who have embodied our mission and who have individually taken action to improve the lives of the people in this great state. Biographies for each of our award recipients can be found on our website as well as in our annual report. I challenge each of you to use their inspirational work as a catalyst for your own action, to elevate your own voice to bring about needed change. And now I have the pleasure of introducing New Futures Health Policy Coordinator, Holly Stevens, who will be presenting this year's Legislator of the Year Award. Holly, over to you.
Thank you, Michelle. And again, my name is Holly Stevens. I'm the Health Policy Coordinator at New Futures. It is my honor this year to present the Legislator of the Year Award. The Legislator of the Year Award is given to a legislator with a complex understanding of issues affecting New Futures' mission and has worked closely with the organization to ensure the health and well-being of all New Hampshire residents. This year, I am pleased and absolutely honored to present this award to Representative Edward Butler. Working on behalf of his constituents in Carroll County District 7, Representative Butler has become one of the legislature's most effective advocates for access to quality, affordable health care. Before moving to New Hampshire, Representative Butler was a psychiatric nurse and an administrator for a long-term care facility. During his time there, he developed one of the first daycare and home care programs for individuals diagnosed with AIDS. Representative Butler's previous experience in the medical field has assisted in shaping his interest and expertise in health-related policy. Representative Butler embraces a collaborative approach and has a strong belief in bipartisanship, which he has demonstrated continuously in his role as chair of the Commerce and Consumer Affairs Committee. As committee chair, his powerful leadership ensured critical changes were made within New Hampshire's healthcare delivery systems. During the past 2 years, Representative Butler led important regulatory changes impacting New Hampshire's health insurance industry as well as the national pharmaceutical industry, which will help to better contain the rising costs of healthcare and prescription drugs for Granite Staters. I would be remiss if in presenting this award, I failed to also mention Representative Butler's work to establish the Legislative Drug Price Transparency Commission. As chair of the commission, he overcame strong backlash from pharmaceutical companies and sponsored several critical pieces of legislation to reform the industry here in New Hampshire. To briefly highlight and summarize, he sponsored or supported the elimination of balance billing by health providers, which is commonly known as surprise medical billing. New drug price transparency requirements allowing the public to see the true costs for medications and requiring pharmaceutical manufacturers to justify drug price increases, a first step in true drug price reform. Policies to ensure appropriate monitoring of hospital mergers impacting consumer costs and access to certain services. And lastly, but certainly not leastly, codifying certain aspects of the Affordable Care Act in New Hampshire law, including requiring insurance plans to cover the 10 essential health benefits, prohibiting the denial of coverage based on a pre-existing condition, prohibiting annual and lifetime dollar limits for essential health benefits, and requiring all health insurance policies include pediatric, oral, and vision care. Together, these bills will go and have gone far to help Granite Staters better afford their health care treatment and the medications they rely on. As we all know, the COVID-19 pandemic has had various impacts all over our state. It transformed the legislative session in ways never seen before. There were many unknowns about how the session would proceed. During that time, Representative Butler continued to work across the aisle and ensure the people of the Granite State were protected and healthy. Given Representative Butler's incredible work, it should come as no surprise that the entire New Futures staff was saddened to hear of his decision not to return to the legislature this following session. As an entrepreneur and co-owner of the Notchland Inn, Representative Butler has decided to spend his time concentrating on running his inn. Although we wish him the best of luck, and we look forward to his continued involvement in policy work in some capacity. Thank you, Representative Butler, for your tireless work improving access to quality, affordable health care for all New Hampshire residents. Your work has had an enormous impact on the health and wellness of all Granite Staters.
Thank you. I am incredibly proud that one of my primary purposes for becoming a representative is being acknowledged in this way. New Futures has been an incredible partner in much of my efforts relative to healthcare legislation. As Holly said, I am not running again. And at the end of a session when legislators are leaving, they can take time in that session at the end of the session to make a statement about and ask for personal privilege, talking about their experience. I didn't do that. I made my personal privilege digital. And in it, I said that one of the things I learned in the 12 years as a state rep is that I am horrible at extemporaneous speaking. So I apologize in advance. In 2006, I became, I was running, and I became a state rep in 2007. I knew I wanted to work on healthcare issues, and so I planned on asking to become a member of the Health and Human Services Committee. But a woman that probably many of you know, Martha McLeod, who works in healthcare in a variety of settings, but now is working in the North Country, working with elderly care issues, said to me at the time, you know, if you want to impact the affordability of healthcare, which is certainly something that we should be doing, you want to be in the Commerce Committee. So I asked for and was assigned to the Commerce Committee. And I loved that work. And as a small businessman, not only were the insurance issues important, but we also dealt with a variety of other pieces that spoke to my experience as an innkeeper and a small businessman. And in my second term, through a set of unusual circumstances, I became chair. And I've been chair in 5 sessions now. It has been an incredible challenge and very exciting. I've worked with a number of groups and advocates and lobbyists throughout the years, but New Futures and its predecessor, Voices for Health, have been an incredible partner in that process. As you also likely know, Those groups who are advocates and lobbyists provide essential services to us as legislators. And New Futures understands the issues with a broad breadth of experience that really helps us to understand how we should proceed or how we should proceed on a particular issue or bill. One of the things that Commerce has taken up over many years are mandates. Should this piece of healthcare be included in coverage in healthcare insurance? It is a contentious issue oftentimes. What is the cost benefit for including chiropractic, acupuncture, midwifery, bariatric surgery, PANDAS, which is a pediatric autoimmunological neurological disease, which is not experienced by many, but is an incredibly difficult situation for families to deal with, and which needed to be supported through insurance. Parameters for telemedicine was a mandate. And even this year, a mandate request that came to us was to cover yoga and other activities, creative therapies that could help people to return to baseline, and yet which are not covered. Yoga was not included, nor was art therapy or music therapy, but those things need to be looked at and we need to try to figure out how those might be able to be covered. So mandates was one piece, and you heard from Ms. Stevens about many of the other bills that I have been involved in or was a primary sponsor of. The introduction of the ACA, which was a powerful time throughout our country, but certainly in this state. There were lots of people in support, and there were lots of people who were adamantly against it, as they are still now. And it was really challenging and exciting to be a part of that process. I brought a few other bills just to, because I would forget otherwise. Extending medical and surgical benefits to domestic partners. Relative to healthcare provider reimbursement for services to patients without health insurance. Establishing a commission to study, no, that one has nothing to do with healthcare. Relative to healthcare provider reimbursement for services to patients without health insurance. Relative to affordable health insurance for small employers, and that became a really critical bill over a couple of years that we were able to achieve. A committee to study the current definition of the term community benefit applicable to nonprofit healthcare providers. Reinsurance pool in the New Hampshire Vaccine Association. And New Hampshire Health First, which was that small employer bill. In 2009, insurance and civil unions, which didn't go anywhere, but at least we brought up the issue. Relative to insurance reimbursement for acupuncturists, which I talked about. Data collection practices of healthcare providers, and relative to the development of an uninsured health care database. The whole issue of access to affordable health care is the basis for all of the things that I think that New Futures is doing relative to health care and that I have tried to be a part of. We desperately need, and we have looked at as a legislative body, a variety of ways of increasing access for those people who have difficulty affording, and yet there's a huge percentage of our population who still can't afford health care insurance. We need to find a way to bring that access to everyone. We have done an amazing job, I believe, in the past 14 years. I was out for 2 years, so the 12 years of my being an elected official. But there is so much more to do. I really want to thank New Futures for this amazing honor and encourage all of you to keep in the fight, to keep working, to help bring affordable care to every citizen in New Hampshire. Thank you.
Congratulations, Representative Butler. It's a well-earned honor. Your presence at the State House and in the Commerce Committee in particular will be deeply, deeply missed. Our next award is our Advocacy in Action Award, which was presented by Kate Fry, our Vice President of Advocacy, to this year's winner, Brian Harlow. Kate had an opportunity to sit down and discuss Brian's advocacy work with him earlier this month, and we thought we would share with you some of their conversation.
Hello, my name is Kate Fry. I'm the Vice President of New Futures, and I'm honored here to be here today to present the Jennifer Whirlwill Norton Advocacy in Action Award. And I will let our recipient introduce himself.
Hi, I'm Brian Harlow of Concord, and very grateful to be receiving the award.
Well, you certainly deserve it, Brian. And one of the things that I think was so clear to all of us is your enthusiasm for advocacy, and Brian is always the first person to respond when we do an action alert asking our advocates to get involved, and he's always at the ready. And so one of the questions I have for you is, what gives you that energy? What draws you to advocacy?
I was drawn to advocacy mainly because I saw, I'm a person in long-term recovery, but when I needed help, when I was 19 and then when I was 20, both times within hours I was in treatment. But I have a lived experience with a loved one, someone I've known her whole life, someone I changed her diapers, someone I watched grow up, and from the time I got her out of a really bad place in Manchester, I just naively assumed, okay, now we'll go to CMC, we'll be into treatment. Well, it turns out it took 3.5 months, and I was very grateful for New Futures, very grateful for the team that I was able to be a part of, which was all pushing in one direction to get her into treatment. And it was a horror show. I had the role of everything from nurse to security guard to social worker, so many other roles, and during that 3.5 months, and that's what led me to start to seek avenues and ways that I could change.
Yeah. And I remember when we were talking about you getting the award and how you were saying that, it felt selfish and that you didn't want this acclaim. The reason behind you advocating is because you didn't want anyone to go through the nightmare that you and your loved one did. And so can you speak about what advocacy's meant to you as far as dealing with that experience and what advice you would give to someone else?
The advice I'd give to someone else first is anything new we do is going to be intimidating, because we don't have any. Confidence is demonstrated ability. I had no confidence. I'm like, what does it even matter? I'm like, are these people just leading us like lambs to slaughter over there? Is it just going to be, feel like a re-victimization? Are people going to figure out what my family's going through? Because shame is what feeds silence, and but it's not like that at all. When I went through my New Futures training, that I recommend anybody go through, not just for the sandwiches, but it's that's where I started to actually believe, because they brought in some state senators, and that stories push legislation. It's not the lobbyists, they help, but people's stories.
Yeah, we always say that it's your own story.
Yeah.
That's the most important story
Yeah.
to tell. And one of the things, too, that I think you know, we felt that you were so deserving of this award, it's because you don't even just advocate for New Futures, but you advocate for so many other organizations, and like NAMI and the New Hampshire Coalition Against Domestic and Sexual Violence. And what is it that's kind of the thread for you there?
The thread for me is, I guess it's like right here and right now, you know, I'm with, I mean, we're on camera, there's other people in the room, but I'm with, you know, a friend, I'm with my people, and but right here and right now, there's a lot of people who are living in hell, and those people are trying to just stay sane from either childhood experiences they had in college, and I'm talking about either witnessing domestic violence, sexual assault, whatever it may be. That's what fuels, you know. And if across the road at NAMI or downstairs at the coalition or on this floor, it's that Venn diagram of mental illness, sexual assault or domestic violence, or substance use disorder, you can start in one circle, you're going to find you're in all three pretty quick. And that's why speaking out is so important. Yeah.
Well, and I can't think of anyone who deserves this more, knowing that this award is given to someone who excels in grassroots advocacy, and it's named in honor of our colleague and friend, Jennifer Werwell Norton, who fought for so many of the same things you have fight for now. She did work here at New Future. She was kind of the backbone behind forming the Children's Behavioral Health Network. And she passed away in 2017, and her legacy lives on through her beautiful family, her husband Steve, and her two kids, Greta and Anders. And I was honored to call her my friend. So many people were, and knowing her spirit, I think she would be so happy that you've received this award. So on behalf of New Futures, I just want to congratulate you, Brian, and thank you.
Oh, and thank you. Thank the staff of New Futures, the board, and like I think I mentioned to you before, you know, I'd like to accept that on behalf of all the grand families that are raising children in New Hampshire, Ohio, West Virginia. But we're definitely up there with our rates of substance use disorders, especially opioid dependence, and I'm doing my best to raise 5 right now. But the thing is, we need help, and so I'd like to accept it on behalf of those families, but especially my mom. You know, anything I do over across the street at the State House, any calls I make, you know, it's much more a credit to her example than mine. You know, if you look up selflessness in the dictionary, you'll find her. But thank you.
Thank you, Brian.
Yeah. If I could, before we end, just take a second.
Mm-hmm.
That, you know, you asked my opinion on advocacy, what keeps me going, what advice I'd have, but if I could just give some advice to anybody who hasn't seen a family member for a while, hasn't reached out to a family member for a while, who does have a substance use disorder, just, you know, don't wait until this video is done. Just send a text, send a call, and let them know that they couldn't be more loved. It's because if they can believe that there's a glimmer of hope, you know, it's shameful enough to have to live with a substance use disorder. I've done it. So many other people have done it and recovered, but just reach out.
I think that's especially true during these isolating times.
Yeah.
So those are perfect words to end with. Thanks, Brian.
Thank you.
Hi, New Futures friends. This is Lynn Chalette from the New Hampshire Coalition Against Domestic and Sexual Violence. I'm so happy to be joining you today to send heartfelt congratulations to our friend and fellow advocate, Brian Harlow. Brian is a deserving recipient of the Jennifer Wherewell Norton Advocacy in Action Award. He personifies what it means to be an advocate. Each and every day, Brian shows us the impact that people can have standing shoulder to shoulder. Brian, we're proud to know you. We're proud to work with you. And I know you don't like to shine the spotlight on yourself very often. So today, I hope you can take a moment to appreciate how many people around you care and appreciate what you do every day. Thank you so much, and congratulations.
I know it's already been said, but congratulations, Brian. It's a treat to listen in and hear more about all that you are doing. You are truly a rock star. Thank you for your tireless advocacy, as well as your postcards, which the entire staff appreciate. I would now like to recognize our 2020 scholarship recipients. And for this portion of our program, you'll hear a bit about the scholarship award from New Futures policy staff, and also learn about why each candidate was nominated by a member of our community engagement team. First up is our Health and Wellness Scholarship, presented by Vice President of Policy, Jake Berry.
Good afternoon. My name is Jake Berry. I'm the Vice President of Policy here at New Futures, and I have the distinct pleasure of presenting this year's Health and Wellness Scholarship to our friend Jennifer Selfridge. First launched in 2002 as the Tom Fox Scholarship, this award originally honored a member of the substance use treatment community. But as New Futures expanded its mission, we've been proud to broaden the scholarship to honor outstanding leadership, service delivery, and commitment to advocacy on health and wellness issues impacting the Granite State. And this year, no one is more deserving than Jennifer Selfridge. Jennifer, who recently retired as the Substance Misuse Prevention Coordinator in Carroll County, has demonstrated immeasurable commitment and work ethic advancing the health and wellness of her community and our state. In her role, Jennifer worked tirelessly to advance substance use prevention policies at the State House. She testified at legislative hearings on issues ranging from youth vaping to alcohol misuse. She sent letters to local and statewide newspapers, and she helped organize community events, bringing advocates together with lawmakers to address prevention issues of importance to their communities. With her true, honest relationships throughout Carroll County and her deep commitment to the health of the region, Jennifer has gone far to prevent substance misuse among local youth, and we're thrilled to honor her with this year's Health and Wellness Scholarship. Jennifer, thank you for everything you've done for Carroll County and for our entire state.
Hi, my name is Katie Foster. I'm a Community Engagement Coordinator at New Futures. For the last 3 years, I've been lucky enough to work with Jennifer Selfridge on issues ranging from Medicaid expansion to Tobacco 21. It's an honor to call her my partner and friend. This summer, Jennifer retired from her position as Carroll County Substance Misuse Prevention Coordinator after 6 years of extraordinary work. Earlier this year, she co-planned a statewide legislative breakfast, and then within a matter of days, came up with the plan to have a breakfast for her delegation, got them all involved, had it all ready to go, and unfortunately, it was canceled just a couple days before due to COVID. This is just one example of all of the change she's made in Carroll County and New Hampshire and how she's made it a safer and healthier place for kids to live. Jennifer's retirement has been felt. We miss her so much, but we're really thrilled for her. Jennifer, thank you for everything you've done, truly.
Hi, I'm Jennifer Selfridge, and I want to thank Katie for nominating me for this award. I mean, I'm flattered and I'm honored to work with New Futures, have been for years. I've been doing prevention in New Hampshire off and on. I had a 10-year hiatus in New York State for 40 years. And I've seen a lot of things come and go and change, but I think we're now finally on the right track. We've expanded our approach to healthier communities beyond just substance misuse prevention or other social ills that we have to deal with, and looking at some of the root causes, whether it's trauma-informed care. We know now we need to be starting much sooner to support young families with early childhood support and support for our working young families who are having a hard time here in New Hampshire. Anyway, it's an honor to get the award. and the recognition. In terms of the scholarship, I really feel it's important that we pass along this torch to people who are currently engaged. I'm now entirely retired, and so in thinking about what to do, when I first talked with Michelle about this, I wanted to be sure that that scholarship money was going to go to continue the work that's happened and has been so successful in New Hampshire for years to come. And so in that respect, I just wanted to be sure things happened that continue to happen. And I first got acquainted with Dover with the Dover group when I first started here, and it's since evolved into Dover Youth to Youth, who have done remarkable things over the last 10, 15 years that I know of. And I'm happy to turn it over to Dana Mitchell, who's the director of Dover Youth to use with his students and to help support youth empowerment and advocacy throughout the state of New Hampshire. Thank you.
Well, Jennifer, on behalf of the greater prevention community, congratulations on your retirement.
Thank you.
Congratulations on this award, especially a great capstone for all the things you've done. Jennifer, up in the North Country, missed some training that would happen down south, and she called me up and said, we have to have it up here. And she got me up to Kennett High School, and she did her Jennifer thing and got youth groups from all around there, all these different schools together, and the adults with them, and buses rolling in, and we had a great day of training up there. So thank you so much on behalf of Dover Youth for the award and passing on that scholarship. And in Dover Youth to Youth, we have 70 students that do a lot of prevention work and advocacy work, including legislative work and media and community projects and campaigns. But probably the biggest thing they're involved in is training, not just the students in our schools, but youth advocates around the state. So I think the most appropriate use of this is we're going to put it in an account, and we're going to use it to do a conference. At some point when we get back into person, we're going to hold a conference. We're going to use every dime of that for training for youth advocates from throughout the state. And I think that would be a great use of that. And we will invite you when that happens.
Thank you. I'll come if I can. But don't hold it too far south.
And thank you so much for thinking of us. And on behalf of the students from Dover Youth to Youth, a really heartfelt thanks.
Well, thank
and
you.
Our best wishes.
Thank you.
Congratulations, Jennifer. We wish you the best of luck in retirement and are excited to continue pushing the work that you care about so deeply forward. It's incredible to see you passing the torch to the next advocate. Really amazing to see, and we look forward to working with them. Next up is the presentation of our Behavioral Health Scholarship, which will be presented by Cheryl Avery, our Children's Behavioral Health Policy Coordinator. Cheryl?
Hi, I'm Cheryl Avery, and I'm the Policy Coordinator for the Children's Behavioral Health Program at New Futures. I'm so pleased to have been asked to present this year's Madeline DeMule Behavioral Health Scholarship to NFI North. Started in 2014, this award is in memory of Madeline DeMule, the former President and CEO of Hope for New Hampshire Recovery, and it is given to an individual or group that does remarkable work in the field of behavioral health. Through their work, NFI North has shown outstanding commitment to the behavioral health needs of children and their families. They have focused on program excellence and have advocated for children in their care as well as those across the state. We are so happy to honor NFI North with the Madeline DeMule Award for their dedication to and work for the children and families of New Hampshire. Thank you so much for all that you do for our kids.
Thank you, Cheryl. My name is Deli Champagne, and I am the Community Engagement Coordinator at New Futures, and I work with Children's Behavioral Health. When I first learned about this award, I said, oh my God, I know exactly who I want to nominate. I nominated NFI North, and let me tell you why. When my son was in middle school, he was diagnosed on the autism spectrum, and he was seeing a therapist on a regular basis. She pulled us into her office one day and she said, I need to let you know that I'm seeing the early adolescent onset signs of a serious mental illness. She said, I want to warn you that the next few years are going to be rough for you. This is going to play itself out and it might get ugly. So we knew that the public school was not going to be able to manage our son's challenges. So we looked around and we found a place called the Kentucky School. This school was a part of NFI North, and our son went there for 4 years. And I do believe that school saved his life. I can't imagine what our lives would have been like without the compassion and the care that he received at that school. So in 2014, after he had graduated, the executive director, Dr. Paul Dan, called me and he said, I'd like to have lunch with you to see if you'd be interested in serving on the board. Well, immediately I knew I wanted to give back to this organization because they had done so much for my son. So Paul and I met for lunch and I said, yes, sign me up. So for the last 6 years, I have served as a member of the board of directors of NFI North, and I have watched with awe how Paul Dan and Karen Cusano have expanded programs in this state without incident. They make it look so easy. I'm sure it isn't, but when the state asks them to provide a necessary service, they figure out a way to get it done. I like to think that they serve all folks and do it well. And the expression that Karen has shared with me that I wanted to share with you is we like to serve folks from a twinkle to a wrinkle. I think that's just so cute. And that shows you Karen's cute personality. But I do want to share a quick story with you. We had a board meeting one day at the transitional housing unit that NFI had taken over from the state. That's the unit that's on the state hospital grounds. And we got to meet some of the residents and hear some of the stories and get a tour. And Karen was telling us that when they first took over the organization, she asked the residents, what do you need? What haven't you been getting? How can we help you? And one gentleman said to her, I like to play the trumpet, and I've just never been able to play the trumpet. Can I play my trumpet? And Karen said, yes, from now on, you are allowed to play your trumpet. And that to me just shows you the care and compassion that this organization exhibits. And it's not just Karen and Paul. I've met a number of folks in this organization, and they all exhibit those same great qualities. So as you can see, this place is very special to me, holds a special place in my heart. So it was a no-brainer that I would nominate them for this award. Thank you.
Thank you, Deli. It's a complete honor to be here today. My name is Jennifer Altieri, and I work with NFI North, and I am the program director of a program within our community-based services called Fast Forward. Today, when I was getting ready to drive south, I'm from the North Country, I pulled up New Future's website just to get the address really quick. And immediately I noticed the values that are listed on the website, which you can see behind me, are advocate, educate, and collaborate. And I immediately got excited because when I think of NFI North and having been a part of the agency for 20 years, that's exactly who we are, that's what we stand for, and I couldn't be happier to be accepting an award based off of those values, because those exact values are what we hold near and dear to our heart. So one of the words that in particular stand out to me is collaborate, and that's something that NFI North truly encompasses within our values, specifically with the variety of services we offer at NFI North. So we cover a multitude of populations to include infants all the way up, children, youth, families, and adults. And with that being said, we do residential treatment, we provide intensive in-home services. We are a child placing agency, so we're able to have the opportunity to license foster homes and also be a part of matching children to their temporary or sometimes forever homes in New Hampshire. So not only do we get the opportunity to work with families short term, we also get the amazing opportunity to work with families long term. In addition to that, the word collaborate, another reason that's very much near and dear to our hearts is we know that we cannot do this work alone. Although we are receiving this award as NFI, we know that none of this work is possible without every single person we collaborate with, that from the families the youth, the children, NAMI New Hampshire, any provider that we work with in the state. So we are incredibly grateful for that collaboration. We take that collaboration very seriously. We actually, from the very beginning, train our employees from day one in the fact that when they go to work with children, youth, and families and adults, we provide them with a training called Family Systems. And that training is so important because right from the beginning, we explain to them that you're not the expert within these families. We want the staff and the employees to understand that the work that they're going to be doing, they're going into these families. The families are the experts. They're truly the ones that know their families the best. We're just joining them. We have the privilege of working with them. We're being invited into their life. And so we get the opportunity and honor to help create a village, really. That's what it is. We're creating a village. We're adding to their people that support them and get them through some very challenging and difficult times. We're just happen to be the lucky ones on the other side that have the opportunity to hear their story, to be taken on their journey with them, and each and every day get to be a part of that. So very much a blessing to be here today and every day with the families that we serve.
Thank you, Jennifer. My name is Karen Casano. I'm the Chief Operating Officer for NFI North, and I have the privilege of working with this lovely woman right here, Jen Altieri, and many of our team. I am so honored as a representative of NFI North to receive this incredible award, and I want to thank New Futures, Delhi Champagne, and the entire group that is involved in identifying this award, and it means so much to us for a variety of reasons, but mostly because it's about advocacy and it's about raising your voice. And we are, from the very beginning of our introduction to somebody that we're supporting or serving, it's all about raising your voice. It's all about having a say in your life to be able to contribute and make your life better. The mission of NFI North is to inspire and empower people to be successful, to meet their goals, to live independently. And we do that through really getting to know someone as an individual. We work so much with people that have behavioral health challenges, mental illness, substance misuse. There are so many challenges that each of us every day live with. And our mission really and our philosophy is to identify who they are as a person, not how they may be diagnosed or what they may have to carry along their journey, but in fact who they want to be as a person. What are your values? What defines you? It isn't if you have a mental illness or not. There is so much more to you. You may have to live with some challenges and some realities with that, but what is your goal? What do you define as success? And we start there. We have a philosophy in our approach called normative community approach, and it really stems from the belief that people are social and want to belong. And if you create an opportunity for membership that's meaningful, that as a part of that, people will establish values and beliefs and behaviors that will help them achieve their goals. And so from the very beginning, and really any age, as Jennifer said and Delhi said earlier, any age that makes sense. We all want to belong. And I can say, having been a part of NFI for 40 years now, and my beginning introduction to NFI was as a recipient of services, that we take quite seriously who we support and how we support them, and that they drive the process. It's just so incredible to us, and it's how we start, how we introduce ourselves, and our incredible employees understand that. They work and come from a place of caring, of understanding, a non-judgment, and we work to truly inspire and empower the people that we work with. So what we'd like to do with this award is to create a community and a culture of advocacy, of people finding and sharing their voice, because we know that's how systems change. So for us, we want to use this award, the scholarship, to be able to offer small incentive grants to the people that we serve to submit something that they would like to see changed for their life for the better. And we want to put that together in a video, and we'd be happy to share that with New Futures and share that on our website, but really to teach people to how they can make a difference and make a change. So the learning, the education and collaboration and the advocacy are just so important in the work that we do, and we know that that's important for New Futures as well. So thank you again on behalf of our entire NFI North community.
Amazing, amazing, amazing. That's all I can say to describe NFI North and Karen's team. We are so pleased to be able to recognize your work and your continued commitment to advocacy on behalf of children. I love what you're doing with the award, and if we could give you more money, we absolutely would. And finally, moving on to our last scholarship of the evening is our Kids Count Scholarship, and our 2020 recipient is going to be introduced and presented by Rebecca Wojtkowski.
Hello, my name is Rebecca Wojtkowski, and I'm the Kids Count Policy Coordinator at New Futures. The Kids Count Scholarship is given to those with a demonstrated leadership and significant service to the delivery of high-quality services to New Hampshire's children and youth. This year, I'm pleased to award the Kids Count Scholarship to Liz Fitzgerald. Liz is the Director of Community Impact for United Way of Nashua. Her commitment to the health and wellness of children and families shines through her work within her community and beyond. Collaborative in nature, Liz has demonstrated the leadership necessary to bring about change within her community. Nashua is a beautiful, diverse city with complex challenges, but Liz does not let tough circumstances stand in her way of action. Liz is always working to provide a variety of family-strengthening events and programs to provide assistance and resources directly to families within her community. When she's not piecing together community baby showers and family movie events, Liz is chopping away at grant opportunities to make certain vital work gets funded. Integral to her community impact work, Liz reunited the Nashua Smart Start table, responsible for creating a plan of impactful action for Nashua's children and families. The contributions to her community are countless, and the City of Nashua and the State of New Hampshire are thankful for her service. Liz Fitzgerald is a true leader. Thank you, Liz, for your service to improve the lives of children and families in New Hampshire. Please join me in congratulating Liz for receiving the 2020 Kids Count Scholarship Award.
My name is Pedro Altagracia. I'm a Community Engagement Coordinator for New Futures. I am assigned to the Greater Nashua region, and during my time in the Greater Nashua region working with coalitions and partners, I have witnessed the immaculate work of Liz Fitzgerald here. She represents the Greater Nashua United Way, and part of the reason I am nominating her is for her excellent work within the community of just the City of Nashua, also Greater Nashua as a whole. From when it comes to community baby showers to fundraising for the Greater Nashua United Way, Liz Fitzgerald has done excellent work for their community, bringing about partners who are solid within their own respective fields and bringing them together for the common good of the City of Nashua. She has highlighted many, many disparities that have been happening on the ground and has uplifted voices to make sure that those concerns are heard, but that the needs of those parents and those children are met whenever they need them. So I'll let Liz introduce herself.
Wow, I'm feeling a little bit weepy there, Pedro. Like Pedro said, I'm Liz Fitzgerald, and I've worked with Pedro for a long time in the Greater Nashua area, and I really respect him and admire his work as a leader and a community member that lifts up voices. So this nomination by Pedro is really special to me, and I'm really grateful to you for calling me out, even though it feels weird to be called out individually for work that's really collaborative. So thank you for that, Pedro. I'm really grateful. And I just feel lucky to be in a role that is my work that allows me to do work that's passionate to me. I've been working with United Way on and off for since 1992, and it just gives me the opportunity to be in the community and working with people. United Way's philosophy is like a three-pronged approach to calls to action so that a community can work together by giving, advocating, and volunteering. And the advocacy work is the hardest piece of it, honestly. So having Pedro's guidance through New Future in our local collaborations really has helped a lot to give knowledge and a voice to people who can speak up for what they know is their reality. So it just feels like a great honor, and I admire this work, and I'm glad to be a piece of it. But I'm joined by many, many, many community partners. So I don't accept this award as an individual. I accept this award as several coalitions that are working together to make Greater Nashua the best kind of community it can be. From the municipality to the many nonprofits to the businesses that step up and stand out when it comes to making our community work for everybody. So thank you. I'm like really touched, and we're excited about this scholarship, and there's a lot of people in our Early Childhood Coalition that are taking some steps forward through a big grant that we received from the Preschool Development Grant. That's a state-funded grant through the Department of Education and Department of Health and Human Services, so which is a massive collaboration. We're really excited about that, and it's giving us real dollars to make real change for families. So I think this training grant will be put to good use for some of the parents and families that we work with that are ready to get rolling and make some great changes for young families in Nashua.
Thank you, Liz. It's wonderful to hear about all of the work that you're doing in the Nashua community to improve your community for the children and families that live there. And thank you again, and congratulations to all of the advocates, partners, and policymakers honored tonight. While we're wrapping up tonight's event, it's my duty to remind you that we have so much more work ahead of us, and there are plenty of opportunities to engage. Whether that be attending a free advocacy training, such as one we have available on November 4th or the 18th, virtually testifying at a hearing, hosting a Zoom meeting with an elected official, or reaching out to learn more about one of our partner field grant opportunities. But above all else, please remember that civic engagement starts and ends at the ballot box. That is the opportunity that you have to make your voice heard more than anything. So please take the time to cast your absentee ballot and figure out where your local polling place is. And if you can, bring a friend. We hope that you all will continue to work with us and collaborate with each other through the coming year to use your voice for change. And on behalf of the entire staff at New Futures, we look forward to working with you, where we will continue our fight to ensure every Granite Stater has the opportunity to start healthy and stay healthy. Thank you again, and have a great night.